Hello, and welcome to today's video. We are going to discuss a condition that is prevalent among millions of elderly people worldwide: dementia. Dementia is a broad term for a decline in cognitive function that makes everyday life more difficult. It is a normal issue among elderly people. Although it may be challenging, having knowledge about dementia, its early signs, and its management can definitely assist in maintaining a high level of living. In this video, we'll explore what dementia is, how to notice its symptoms, and most importantly, how to prevent or cope with its effects. Section 1. What is dementia? Dementia is not one disease. It's a general term for a group of symptoms that harm memory, thinking, and social skills enough to interfere with daily life. The most common type of dementia is Alzheimer's disease. Other types include vascular dementia, Lewy body dementia, and frontotemporal dementia. Every form of dementia has its cause and how it worsens, but each type entails the deterioration of brain cells, causing a decline in thinking abilities. This decline typically occurs gradually and continues to worsen with time. Section 2. Common causes and risk factors of dementia. Dementia is more common in older people, but it is not a part of normal aging. Dementia can be caused by many risk factors. Some of the risk factors can be controlled, and some cannot. 1. Aging is the greatest risk factor for dementia. As age increases, so does the risk of developing dementia, especially after the age of 65.2. Family history and genesis. There is a history of dementia in your relatives. You may be at greater risk. Certain genes contribute to diseases like Alzheimer's. 3. Chronic conditions. Certain conditions like high blood pressure, diabetes, and high cholesterol can increase the risk of developing dementia. This is particularly so for vascular dementia, which is connected to problems with blood supply to the brain. 4. Head injury. Severe or repetitive head trauma has been found to increase the risk of developing dementia when older, including conditions such as chronic traumatic encephalopathy (CTE). 5. Lifestyle factor. Smoking, heavy drinking, an unhealthy diet, and a lack of exercise can all increase the risk of developing dementia by worsening brain health. 6. Heart health. Bad heart health is connected to dementia because heart problems can limit blood flow to the brain. Keeping the heart healthy with good food, exercise, and managing stress is important for brain function. Section 3. Early symptoms of dementia. Reckoning the early symptoms of dementia is vital in order to seek help and assistance promptly. The symptoms vary depending on the type of dementia, but some common early warning signs include: 1. Forgetting things. Forgetting is commonly the first sign of dementia. Forgetting recent events, appointments, or the names of friends and family members are examples. As dementia progresses, memory loss occurs more frequently and is much worse. 2. Difficulty with communication. People with dementia may struggle to find the correct words, to repeat themselves, or to enter and remain in conversations. They may also struggle to hear others. 3. Disorientation and confusion. Elderly people with dementia may not recall time, dates, and locations. They may also not remember how they arrived somewhere, or be uncertain about the day of the week. 4. Difficulty in finishing familiar tasks. People with dementia can find it difficult to do things they once found easy, like cooking, handling money, or using everyday appliances. 5. Changes in mood and behavior. Dementia can result in personality change, such as greater anxiety, agitation, depression, or mood swings. They can become withdrawn or even show signs of frustration. 6. Poor judgment and decision-making. People who have dementia can make bad choices, like wearing the wrong clothes for the weather, spending large amounts of money, or not taking care of themselves. 7. Ceasing participation in social activity. People lose interest in social interactions or activities that they used to enjoy, simply because of frustration with cognitive deterioration or shame. Section 4. Types of dementia. Alzheimer's is the most prevalent form of dementia, yet there are several other forms of dementia with other causes and signs. 1. Alzheimer's disease. Alzheimer's is the most common form of dementia. It results in loss of memory, confusion, and alteration in behavior. It happens as a result of the buildup of amyloid plaques and tau tangles in the brain. The buildup affects the communication among brain cells. 2. Vascular dementia. Vascular dementia results from reduced blood flow to the brain, typically as a result of strokes or other cardiovascular disease. Problem solving, planning, or decision-making may be impaired. 3. Lewy body dementia. Lewy body dementia is composed of abnormal protein deposits that build up in the brain. A few of the signs are visual hallucinations, problems with movement like Parkinson's disease, and cognitive change. 4. Frontotemporal dementia. FTD. FTD is the breakdown of the frontal and temporal parts of the brain. This can change how a person behaves, their personality, and how they use language. It usually occurs in younger people, typically under the age of 65. 5. Mixed dementia. Simites. People develop more than one kind of dementia, like Alzheimer's and vascular dementia. This is called mixed dementia, and it can result in a mix of symptoms from the different kinds of dementia. Section 5. Strategies for prevention and risk reduction. There is no cure for dementia, but there are some ways to minimize the risk or delay the occurrence of symptoms. 1. Stay mentally active. Activities that challenge you, like reading, doing a puzzle, learning something new, and memory games, can help keep your mind active. Lifelong learning and keeping the brain active can delay the onset of dementia. 2. Exercise. Regular physical activity increases the flow of blood to your brain, which works to keep the mind healthy. Physical activity like walking, swimming, or dancing on a regular basis can lessen the risk for dementia and other brain disease. 3. Eat a healthy diet. Eating plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats is good for the brain. The Mediterranean diet, which is high in omega-3 fatty acids, is especially helpful for brain function. 4. Manage chronic conditions. It is important to keep conditions like diabetes, high blood pressure, and high cholesterol under control for brain health. Regular checkups and following your doctor's advice can help prevent or manage these conditions. 5. Social engagement. Socializing and having positive relationships with friends and family are critical to mental and emotional health. Social interaction keeps the mind engaged and minimizes opportunities for depression and isolation. 6. Get enough sleep. Poor sleep quality is also associated with thinking problems and dementia. Try sleeping 7-9 hours nightly and follow healthy sleep routines to sleep restfully and healingly. 7. Avoid smoking and excessive alcohol consumption. Drink alcohol and smoking tobacco can raise the risk of dementia. Quitting alcohol and decreasing its consumption can revive brain health. 8. Stay stress-free. Chronic stress can harm the brain. Employ stress-reducing strategies like yoga, meditation, or slow breathing to help maintain a healthy mind. Section 6. Caring for a person with dementia. If you're looking after an individual with dementia, it is critical to create a helpful and organized living space for them. Some of the caregiver tips include: 1. Establish a routine. A daily routine can make people with dementia feel more secure and less confused. Try to keep the same meal times, sleep times, and activities. 2. Create a safe environment. Make the house safe and clear of dangers. Think about putting in grab bars, getting rid of sharp items, and using easy, clear labels to help the individual get around. 3. Foster self-sufficiency. Let them do as much as they can on their own, but assist them when they require it. Assisting independence maintains their dignity and provides them with a sense of control. 4. Offer emotional support. Individuals with dementia may become frustrated, anxious, and confused. Provide them with reassurance, patience, and understanding to assist them in coping with these emotions. 5. Get support. Caregiving can be daunting, so try to find support from friends, relatives, or caregiving support groups. Never be afraid to ask for help when you need it. Conclusion. In summary, dementia is a challenging condition that affects many elderly individuals, but understanding the symptoms, prevention strategies, and caregiving tips can make its impact less severe. It cannot be cured, but a healthy lifestyle, mental and social engagement, and early intervention can reduce the risk of dementia and improve the lives of individuals who have it. Thank you for viewing today's video. If you found this information useful, kindly like, subscribe, and share with others who can benefit from it. Let us keep helping each other keep our brains healthy as we grow older. Take care,